All right, good morning, YouTube. It's morning here in New York City. I am back after a pretty long hiatus. I haven't made a video probably since maybe October, something like that. Life has been insane. I've been healing, just normal stuff. It's amazing, like, after the surgery happens, how you just kind of you fall back into life, but like a new life. I absolutely have a new life post-op. And a big purpose for this video today is just kind of to talk about where I am with everything, with being post-op, with living in the world as post-op, with how people are reading me, my thoughts on my transition so far. It's going to be a little bit all over the place, I can already tell. I've had way too much coffee. I'm actually heading out to the gym in a little bit because I am back working out. I actually have gained a little weight post-op. I got really lazy, and while I was waiting for my scars to heal, I just wasn't working out as much as I had been before surgery. So whatever, we all fall off the wagon, and then we hopefully all get back on it, which is where I am now. Trying to do what's best for my body, and because I'm just like obsessed with touching my chest, and for those of you that are recently post-op, or maybe even down the line a couple of years, it's hard not to touch your chest. It's like the thing that you worked for so long, and the one thing that you wanted. It's really hard not to like feel yourself up all the time. And I do it subconsciously in public. I'm always like, yeah, and I'll be in the middle of a conversation and I'll catch myself just like rubbing my chest. But whatever, I earned it. It was expensive. It was a lot of pain. It was a lot of care. I got to this point. I worked really hard to get here, so I'm loving it. So without further ado, I want to go ahead and show. I had surgery on September 15th in Florida with Dr. Garamoni, which means that I am September to October, October, November, November, December, December, January. So I'm almost at the 5-month post-op mark. But I just want to kind of show how things are looking. So, all right. So here is my chest now. It's funny because when this little indentation right here is eventually, like, you can actually see I can flex because I've been working out my pecs, which I really kind of like. Anyway, like I said, all over the place today. This eventually, hopefully this little indentation is gonna go up higher as I build my pecs up a little bit and I get more of that definition in here. But I do have some good muscle, like it's coming in. I'm still very flat, so I'll just do the side view. I do have these little fat pockets right here, which were not taken away during surgery because this is just normal tissue. This was not like breast tissue. So that'll be something that I have to personally work on. But in terms of my scar, like, I'm going to get as close as I can. Actually, the light sucks when I get close, so I have to stay right here. It looks a lot more red on the video than it actually does in real life. And in fact, these little places right here are starting to turn white just a little bit, which is really neat. I have no dog ears. I guess, I don't know if you'd call this a dog ear. From the, when I lift my arms up, I don't really have any additional hanging out under there. And apparently a lot of people have complained that Garamoni leaves dog ears on bigger people. I didn't have that experience. I don't know if it's just my body, if I just got lucky, whatever it is. The incisions do go back pretty far. But if you've watched any of my other videos and you remember how scarred and screwed up looking it was under here and all lumpy and all that, it's really flattened out nicely. And you can't even really feel anything right here. I start to feel the scar maybe around here, but this is all very, very smooth, which is nice. So, and in terms of the nipples, I have stretch marks around both my nipples. And I believe that that's because I had stretch marks in that area before surgery, and they've just come back, and that's just something I'm going to have to live with. It doesn't really bother me very much. I'm overweight, I have stretch marks. I'm trying to lose weight. I don't know if they'll go away. I don't really care. What I care about is the fact that I have the chest that feels like it's mine, like it belongs on my body, and I'm very comfortable with it. And now I just have to keep working out more and building it up a little bit because it is, I'm pretty flat. But that's what we all wanted, right? Was to be flatter. At least I did. So anyway, I'm gonna put the shirt back on. But yeah, so just one more little view of the chest. I'm really happy with my results. Absolutely. Oh, and as far as feeling, I have no dead spots. I can feel everything here. A little less so like right on the scar itself, but I can still feel this. It's just not super intense. As for nipples, I don't have a lot of sensation, but I can feel this very slightly. So, and actually just one more note about the nipples. I have more nipple on this side than I do on this side. I don't know if it just fell off or if there just wasn't that much tissue there to begin with. But it's not really noticeable. Like if you look at me, it's really only noticeable from my angle up here, and it doesn't bother me. It's just one of those things that happens, you know, nothing is perfect, but I'm pleased with it. So yeah, sorry, just trying to get the shirt back on so that I'm not naked this whole time. Yeah, so in terms of how life has been going, life is good. Life is good. It's definitely different to leave your house not feeling like you have to cover everything up. I still kind of am in awe every day when I get dressed and I put a shirt on and I'm like, really, that's it? I'm dressed? I don't need a bra, I don't need a binder, I don't need any of that. I just put on a shirt and I leave, and it's fantastic. Especially working out too, not having those extra layers. I didn't realize how much I was sweating until I didn't have any material to absorb the sweat underneath, so I actually get like little sweat marks on my t-shirt, which is exciting. It means that I'm doing, you know, I'm doing enough, and I'm sweating a lot, and it feels really good. Working out, walking upstairs, things like that are so much easier without the compression, because I can actually take a full deep breath. I find myself getting out of breath less, especially things like walking upstairs, because I'm not squeezing everything in and cutting off my circulation and my airflow. So that's a major change that's happened. I know somebody had asked me about clothing. Have I changed size in clothing? No, not yet. I mean, this t-shirt's a little big. This is one of the workout shirts that I wear because it's longer. So there is some extra material under here, which when I was wearing a bra and a binder, it wasn't as noticeably big. So in that sense, I can wear a little bit tighter fit t-shirt, and I actually really like seeing my chest under the t-shirt. It looks good, it feels good. This is the side view of the chest. Now I do have a little, I don't know if it's my body or what, but I tend to go out a little bit here, and I don't know if with building my pecs if that will flatten out. These are all little things that I think are just specific to my body. And we're our own worst critics, so of course I'm looking at my body much more critically than probably anybody else will. But anyway, back to clothing. I have started to wear ties and button-up shirts because they look better on a flat chest, in my opinion. So that's been exciting, that I get to kind of expand my wardrobe. I'm trying to think of any other changes with clothing. No, not really. In terms of walking around in the world, what I find interesting is that I am misgendered just as much as before I had surgery, which is very disappointing. And I don't know what it is. I haven't really been able to pinpoint it. If you have not watched any of my videos, I identify as non-binary trans masculine. I do still use the Butch identity. Use is the wrong word. I am Butch. I just also happen to be non-binary trans and trans masculine and gender non-conforming, gender queer. These are all words that work for me, that feel good to me. You know, I think a lot of the time when I'm misgendered as female, I have a theory that it's because they assume that I'm a masculine woman, and they kind of want to let me know that they see me as a masculine woman. Maybe it's the fight that butches have gone through for a really long time with, you know, being butch and not being seen as a man. I don't know. I'm just kind of hypothesizing here about that. But, you know, it does not cease to be frustrating to walk around all day in the world feeling one way about myself and my body, and then having other people kind of invalidate that by misgendering me as female. I personally, when I look at myself, I don't see female. I don't see male either. I do see masculine, but I do not see female. So I don't know what that means for the future. My goal right now is to take the next year to work really, really hard on my body and to see what I can do naturally with weight training and weight loss, and to kind of reevaluate my shape. A lot of people have asked if I'm going to go on testosterone. As of today, I would say no. What the future holds, I'm not sure. I've never really thought previously that testosterone was part of my journey. But, you start to question that when you feel one way internally and you're presenting in a certain way, and then other people are not recognizing all of that. And it's not that I can't validate myself, but the validation from the outside does kind of support everything that I am feeling internally. I don't know if this is making sense. But, let's say that I had blue hair, right? Or that I thought my hair was blue. And I dyed it blue. And then I walked around outside and everybody said, oh, your hair's brown. And I'm saying, no, my hair is blue. And they're saying, no, it's brown. You must be colorblind, or you must not know what the color blue is like, because your hair is not blue, it's brown. But I'm over here knowing my hair is blue because I put the work in to make it blue. So that's kind of how I feel. Is like I've put the work in to create this body that looks androgynous, looks more male, but I'm still being read as female. So it's, I don't know. I think I've kind of described it now. I think I'm just babbling. But it is still frustrating being misgendered daily. And I've been thinking about potentially changing my name. I have started using neutral pronouns in queer-friendly spaces. I've had some of my friends switch over to neutral pronouns, and it's going well for the most part. I'm not really caught up in it must be neutral pronouns, because I can't really switch at work. It would just be way too complicated at this point to do any of that, so I've kind of just made peace with the fact that I'm going to be referred to as she and her in some ways, and they and them in other spaces, so whatever. The beautiful thing about being trans and transitioning is that I don't think there's necessarily an end point with this. I think that the starting point is perhaps more, I kind of know when I started this journey, but when I'm finished with this journey, I'm not really sure that there is an end point. I think that transition, everybody goes through transition of some kind, and it's growth, it's getting older, it's establishing yourself, it's really figuring out who you are. And it's a beautiful process, and mine is not always easy. It's easier than some, and it's harder than others. And I'm really kind of getting to a point where I'm very, very, very sure of who I am, which is a beautiful thing. And I just turned 35, so I'm not in my 20s. I'm not in college age, all that. I'm beyond that. I've lived before even realizing or knowing what the term transgender was, or I don't know. It's taken me a while to get here, basically, is what I'm trying to say. And I feel like I've earned it, and I've really come to an understanding about who I am and what I want and what I need, and that feels really good to know those things. So if you're on a journey and you're at the very beginning of the journey, I'm sure that you've seen a lot of videos of people saying that it gets better and it gets easier and all that. It is absolutely true. Just do what feels good for you. Do what you feel is safe. Talk to people that you know are going to support you. Try not to put yourself in situations where you may, I don't know how to phrase it, but find your support system, however you find that support system. There are plenty of us that are making these videos that are here to support everybody else, because we've been there and we've gone through it, and we continue to go through it every day. So find your support system, keep yourself safe, and just remember that, whatever stage you're at now, things generally do get easier. So I think I've gone off topic and I've babbled plenty, but if there's anything that anyone wants to know